heart has 4 chambers. The right side 2 chambers, left side 2 chambers. Now the impure blood coming from the tissues goes to the right side, from there it goes to the lungs where it gets purified, comes to the left side, then goes to the tissue. Now the blood has to go like that in a single path. It doesn't go back. That is because there are valves inside the heart which direct the blood so they go in the right direction. Now sometimes these valves can get damaged. These valves may not be able to open properly, or the blood coming from above down, when the lower chamber is pumping, there can be leakage of blood back. So these are called leakage of the valves. So valves can affect it like this. They can undergo narrowing or they can start leaking. When these problems become severe, they require treatment. For a long period, they can be managed by medicines. However, if the problem becomes severe, then we need to do some treatment. Like sometimes without surgery, the valve can be opened by a balloon called balloon valvotomy. If the disease is advanced, if it is not suitable for balloon, or if the valve is leaking, then you have to go inside and do a open heart surgery, either repair the valve or replace the valve. Now these two are commonest problems in adult people. There are however other problems like tumors in the heart. Sometimes there can be fluid around the heart like that. Now many of these diseases, we have to know that they are to some extent preventable, or if we can diagnose them early, we can keep a person healthy for a very, very long time, many, many years with the medical management. If you don't diagnose properly, if the person doesn't take care, if they don't get proper treatment, then the heart disease can advance and can go into the heart failure. When we say heart failure, it doesn't mean that heart stops. What it does is, because the heart normally has to pump blood to an extent that is needed by the body. For an adult patient, it has to pump 4 to 5 liters per minute. For a child, it doesn't have to pump that much. It's maybe 1 or 2 liters depending upon the weight. Suppose the adult patient requires 4 to 5 liters. Because heart got damaged, it may pump only 2-3 liters. Then these people develop a lot of symptoms, breathing difficulty, swelling of the feet, all these symptoms, and they cannot be managed medically if the disease is advanced. In that situation, the only option to keep them alive is change the heart, called heart transplantation. That is, you remove the diseased heart, then you bring a new heart from someone who is brain dead. You know, following accidents or bleeding into the brain, sometimes people have what is called brain death. In this brain death, heart keeps working, but the brain is not working. They are in total coma and they will not recover. Once proper specialists make the diagnosis, then if the attendants of that patient give permission, we will be able to take that heart from there, put to a patient who is very sick, who is on deathbed. Now, so we do the transplantation, some of these patients can live for many, many decades, giving them good quality of life. Now, remember one thing, we know that many of these things can be treated with the medicine. Sometimes you require surgery, either bypass surgery or angioplasty or valve replacement. But that is not the end of the story. Once the surgery is done or procedure is done, we have to remember that we have to take lifelong precautions.